Good afternoon, doctor. My name is EshikaParuchuri, and I'm in 10th grade studying in the United States. Welcome to the Healthy Teens podcast. It is my honor to have you on my podcast where we will be talking about ways that teens can improve their health. And I do this by discussing various topics with experienced doctors like you on this podcast to promote health and tips that teens can take to incorporate into their daily lives.
Thank you.
Today, we have Dr. Rajashree, who is an expert gynecologist and obstetrician in Hyderabad. She is based in Renova Hospitals in Hyderabad and has an experience that spans well over 25 years. She graduated from the Osmania Medical College in Hyderabad and has a wide knowledge of gynecology and pregnancy and female-related issues. Dr. Rajashree, would you like to introduce yourself?
Yes, I'm Dr. Rajashree, a consultant gynecologist. I'm a consultant to two corporate hospitals. Renova is one, and another one is Premier Hospital in and around Mehdipatnam, Hyderabad. I have my own clinic. I have my own practice too. So I've been in this field, gynecology and obstetrics, since 25 years. So I'm a well-known person in and around Mehdipatnam, more so with the public of Langar House.
Okay, thank you. Okay, so let's begin with the questions. Dr. Rajashree, what is gynecology and what is obstetrics?
Gynecology is a subject that deals with female reproductive system completely, and obstetrics is a subject that deals with pregnant ladies, any issues related to pregnancy and infertility, as well as regarding antenatal part and postnatal part during the labor. All this comes under obstetric jurisdiction.
Okay, and what is the difference between these two?
That's what. Gynecology deals with a female reproductive system apart from pregnancy. All the pregnancy related issues will go to an obstetrician. So we in India practice both obstetrics and gynecology together. But in some countries, they practice only some of the obstetricians, they don't practice gynecology. Some of the gynecologists, they don't practice obstetrics. So here in India, we are OBG specialists. We are expertised in dealing with the pregnancy related issues as well as non-pregnant issues in a lady.
Okay. And what is the role of a gynecologist in women's health?
Gynecologist has got a great role in women's health, starting from her teenage till her menopause, because the lot of teens coming to us in adolescent age with the late puberty, early puberty, late menarche, early menarche, and menstrual irregularities, and then again in the reproductive age group. They have their own issues, right from the infections, different types of infections, or different types of menstrual irregularities. And even after the 40s, they're coming with the perimenopausal issues and menopausal issues after 50 and postmenopausal issues after 60. So a gynecologist's role in a women's health is bigger. You need to, what we ask the patients is to approach us every year and discuss with us. So that's the type of rapport we maintain, and we maintain a relationship with our patients. So they do come to us regularly, starting from right from their teenage. Thank you.
Okay. And usually, what types of examinations do you perform on patients?
We do local examination, external examination, examining the externally genital system, like external organs like labia major or minor, clitoris, and the introitus part of it, if they have any infections or cysts or folliculitis, because of the hair removers they use, and because of the chemicals. There will be darkening of the skin. Some people, they'll have a skin infections. It could be a fungal infection or a bacterial infection, like bacterial like impetigo, and fungal infections like candidiasis or tinea corporis, tinea cruris, like that. They do come with us, and we examine externally and come to a conclusion. And for the internal examination, if the patient allows us, and if the patient is already exposed, then we'll have a channel, and we'll have a route to go approach per vaginally to feel the cervical part, and to feel the bimanual examination, to feel the uterus and the size of the uterus, and if there are any swellings and fornices, anterior, posterior, lateral fornix, we determine those. If there are any cysts, or if there is any palatable cysts, then we do examine the size of the uterus and size of the ovaries. So internal examination will do like that, and we do a perspiculum examination where we can see the cervix, the health of the cervix, if there is any erosion, if there is any ulcer, if there is any growth of the cervix, then near the cervix or in the cervical canal, if there is any polyp or a fibroid of the cervix. So we do all this. We to find out if these are there or not. So it is external examination, internal examination with a speculum examination, and we take, if there is any proper finding, we do take the help of a radiologist, then sending the patient for an ultrasound examination.
Okay. And based on your experience, what are some of the common diseases or illnesses that persist among teenage populations
Diseases, illnesses,
or conditions?
infections. Like as I already told you, if there are any skin infections, it could be scabies or tinea or candidiasis, or mucosal surfaces infections inside. Most commonly, it is trichomonas vaginalis, or it is a fungal infection, candidiasis, or any other sexually transmitted infections. It could be viruses, bacterial infections, or fungal infections. Then, you wanted to know about the infections or conditions, gynecological conditions?
Sure.
Gynecological conditions, will mean many gynecological conditions. There could be polyps or fibroids inside the uterus, so, or any outgrowths on the surface, on the outer part of the vulval region, like Bartholin cyst or infected Bartholin cyst, which becomes an abscess. Things like that. So there are so many. I mean, it could be anything related to genital organs, or it can be simple growths also, simple polyps from the cervix or the cervical fibroids. So it could be tumors, ovarian tumor, or simple ovarian cyst, or pathological ovarian cyst, or hydrosalpinx, or pelvic inflammatory diseases. These are the disease part. And non-disease, hormone related, or bleeding problems they can come with. So with menorrhagia or polymenorrhea. Polymenorrhea is they repeatedly menstruate in once in 15 years, like that. Menorrhagia is excessively. Some people they bleed, or people come with the scanty bleed, or people do not bleed for months together. They go into secondary amenorrhea. So these are the non-infectious hormonal conditions.
Okay. And could you talk about one interesting case that you have dealt with where the patient was a teenager or a young adult?
Yes. The interesting case was there's a family, there was a family who was residing by my side. Their relatives, they have brought their relatives girl to me, and They told me that she is not menstruating and she never attained menarche, and she is yet to write her 10th examinations, and she is 16-year-old. So then I examined her facial appearance, her unwanted hair on her face, the facial distribution of the hair pattern on the face, all appear to be a male pattern of facial hair distribution. And she physically also appears like male. She did not develop any secondary sexual characters like breast formation, and then I did an ultrasound pelvic examination on her. Then I found mm, she doesn't have a uterus. She doesn't have gonads like ovaries, and there are um, swellings in the pelvis which were resembling testes. So then I ordered for hormonal tests. So her pattern of hormones are androgen testosterones were dominating. Then I did a chromosomal analysis test, and she was showing the male pattern of chromosomal DNA was with XY. So then I said, it's confirmed that she is not at all a female. She is a male, but her external genital organs not very well developed. That's the reason parents could not judge properly. They were ignorant, uneducated parents. So they thought that boy was a girl, and they have given her a name Renuka, and she was treated like she was wearing female dress. She was always treated like a female, and she was playing, but she was never interested in playing with girls. She was always interested in cricket. She was all the, even her thoughts, even her mindset, everything was male. So then I took her to a urologist. They have done an excellent job on her. I took a help of a urologist. So they have done an excellent job of plastic surgery of bringing down the testes which were there in the abdomen. They have reconstructed that scrotum like where her clitoris was overhanging with the bulge. So they have made it a scrotal sac and brought down the testes. They reconstructed, and the clitoris, there was a swelling, and they have with the mold and with some extensions, they have reconstructed it as a penile structure. So now now she's a proper male. Her name is changed to Renuka Prasad, and he has written the exam as a male student. So that was quite an interesting case in my career.
That's very interesting. So, usually, how do patients react to such breakthroughs? Like, what are their reactions when they come across maybe some kind of condition they didn't know they had? Or
They'll be very anxious. They'll be very confused. They'll be very scared to know. So we need to counsel them. We need to take them into confidence. We need to sit with them, talk to their parents, talk to the family members, give a proper counseling, and then explain them pros and cons of the condition, the treatment modalities, and explain how the treatment can help them, or if not treated, how bad the condition will go into, or what are the complications in untreated cases. So we take them to confidence, we explain them so that they'll come out of all the beds and they'll come for a proper treatment.
okay. And what kinds of foods should, especially female teenagers, be eating to maintain their reproductive health?
What I would like to suggest is Nowadays, teenagers, most of them, they are presenting with polycystic ovaries and polycystic ovarian disease, and it goes into polycystic ovarian syndrome. This is all because of the diet. Uh, Diet. First, I'd like to tell you, say no to fat foods and junk food, and then artificially aerated flavored juices or beverages, then maida based, all purpose flour based foods, then too much of sugars, too much of sweets, and artificial sweeteners and artificial salt. For the taste is not good. Ajinomoto is not at all good, and artificial essence or flavors, colors, food colors. Say no to all this. Say no to oily food, deep fries. Then say no to bakery food. Say no to cheese. Say no to mayonnaise. So have a healthy diet, like include different colors of include natural color food like carotenes, then carrots, beetroot, capsicums, different colors of capsicums, then have more of veggies, more of salads, then have plenty of water, then have iron rich food. Iron rich food is jaggery, then iron rich food is spinach. And then along with this, take vitamin C content food like amla, lemon juice, citrus fruit juices, citrus fruits like. Then take dry fruits, have dry fruits, plenty of oral fluids. I think you must go for green leafy vegetables, dark green leafy vegetables. So, and egg is good. Egg is a white of an egg is completely albumin. It's a protein, complete protein. That is also very good for health. So, switch off all these unhealthy diets and switch on to the healthy diet pattern.
Okay. And how would you address irregular menstruation cycles that may occur?
As I told you, irregularities can be overbleeding or scanty bleeding, or a number of times some people they bleed, or some people they did not bleed for months or some years also. So depending on the age, depending on the weight, depending on their comorbidities, depending on their blood work, the reports, their hormones, we have to take into so many factors into account. Then um, prescribe her a treatment, because the treatment modality varies from person to person. Not every person will have the same prescription. That way, we can copy paste to all the patients and give only one prescription, isn't it? We can't do that. Treatment modalities varies with so many factors. We can't generalize. We can't give one particular treatment to every person. So, so many factors we have to take into account. Then you have to frame one particular prescription to one particular person. The same with another person, it will be different.
Okay.
It's like that. We can't generalize.
Any other advice that you would give to young adult girls?
That's what lifestyle modification is must in these days, because the food we consume is with toxins, is contaminated with many chemicals, many pesticides, insecticides. So a lot of toxins we are consuming along with so the nutritious, we are not getting the amount of nutritious diet we are supposed to get, although we are eating different types of food because of the toxins. And how do you get rid of these toxins is only with lifestyle modification, going to a healthy diet, doing vigorous workouts, vigorous physical activity, then framing one particular sleep pattern, uh, because sleep pattern is also very, very important. These days in India, most of the teenagers, they work for other countries and they sleep during daytime, they're awake during nighttime, where most of them, they are succumbing to the hormonal imbalance because of the sleep pattern, because hormones are all stored in the brain and they will be released from the brain, from the hypothalamo pituitary gland, when they when the brain goes into deep sleep. So the brain has to go into deep sleep and the whole world should be dark around them. Then only the brain releases hormones, and the hormones traverse from brain into the blood circulation and they execute their functions over the genital system or the female reproductive system. So this is how they work. So a person need to have a deep sleep, and the surrounding will should be darkness. So the melatonin has to work, the growth hormone has to work, and rest of the hormones they will be released into the circulation. But it's not happening with the software people, where they're sleeping when there is sunrise, which is not done, where the hormones they do not get released from the brain. So hence they have a lot of hormonal imbalance, a lot of disturbances in the hormones. And because of the hormonal imbalance, they're going into PCOS. And PCOS is a condition, it's a polycystic ovaries. If you want, I can show you the on the model. This is the model of the uterus with the tubes on either side and with the ovaries on either side. This is how exactly it will be in a human being. So in case of PCOS, where there will be many PCOS is polycystic ovarian syndrome. PCOD is polycystic ovarian disease. So poly is many and C is cis ovaries. So many cysts around the ovaries, hindering the release of egg from the ovary, and causing the hormonal imbalance. Only when the egg releases from the ovary, it will be caught by the fimbrial end of the tube, and the egg traverses towards the uterus through the tube, and when it reaches the uterus and the uterine cavity, by then the uterus also will have another uterine cycle where the endometrial bed is formed, endometrial thickness will be formed, so as to invite the fertilized egg to get implanted onto the endometrial bed. So if the ovary, if the follicle which has been released from the ovary is traversing towards the cavity, and by the time it traverses towards the cavity it is fertilized, that fertilized egg will be implanted into the endometrial thickening. If it is not fertilized, the egg will be dropped out along with the endometrial thickened bed. The endometrial bits will be flushed out through as the menstrual cycle. So this is how regularly every month happens. So, but then in PCOS, when the cysts are there around the ovary, the egg doesn't release properly. If the egg doesn't release properly, there is no chance of having a bleed. So there is no chance of the hormones getting released after the release of the egg, which usually happens. So when the estrogen doesn't get released from the corpus luteum, doesn't form, so the cycle doesn't happen. So the person may go into irregular cycles, may not menstruate for months together. So this is how it happens. In some cases where the chocolate cysts form, or any endometriosis takes place in any part of the genital system or outside the genital system, Then there will be a pelvic pain, a lot of dysmenorrhea, which is called pain during menstruation. This usually happens when the patient has endometriosis. So this is another condition where the teenage girls suffer a lot with endometriosis, having spasmodic pain where they will be confined to bed for the first 3 or 4 days till the menstruation stops. That's how it is.
So now let's talk about your career as a gynecologist and obstetrician. What have you seen differently from when you first started working in this field to now?
Technology wise, we have high end ultrasound machines, and previously, when I started my career, ultrasounds are very primitive. They were not able to catch all the uh, congenital anomalies. And now that prenatal screening tests are there, so in pregnancy, we do prenatal screening tests to determine, to find out if the fetus is carrying genetic abnormalities, where Down syndrome as early as 12 weeks, that means as early as 3 months of pregnancy, we are able to detect and find out if the baby, if the fetus is trisomy 21 positive. So then we explain the family, we discuss with them whether to continue the pregnancy or not, and we take a decision depending on the family's decision. So it's like that. Very early in pregnancy, we are able to come to a conclusion whether baby is normal or has a genetic deform genetic abnormalities. So if there are any genetic abnormalities, we are explaining to the patients. So, and then when I started my career, I was not seeing too many PCO patients. Now that on regular basis, every third or fourth patient is a PCO patient, PCOD patient. So a lot of changes, technology wise, even the patients, and also now that patients are educated, they know everything in and out of gynecology, and they know about the body system. They go through Google and they search in the Google and they come to us. They ask so many questions, and previously we were not talking to them. We give a diagnosis, they oblige, and they follow us. They have the trust of faith on us. Even now they have trust of faith, but still they cross check with Google and all, and they ask so many questions. So we have to counsel them or take them into confidence. So it's getting like a lot of counseling nowadays. No, it was not like that previously. They used to accept. Now the acceptance part and all, we need to counsel. So it's like that.
What is the best and the worst part of being a OBGYN?
Best part is the satisfaction. At the end of the day, although it's hectic or even nights in the middle of the night here in India, when we see a patient gets attached to us, the patient-doctor relationship, and they completely trust on us. They want us for each and everything. So I think sometimes we can't move so easily when we have expected date of deliveries and expected cases with us. So it's a patient, it's the trust, it's the dependency. We become responsible for the whole of the family. So, but then the satisfaction is after all the stress and all, we go through a lot of stress because in some high risk pregnancies, in some cases, they go into complications. We handle the complications, And when the patient goes into when the patient is in labor, when the baby goes into fetal distress, then we terminate the labor procedure and we take them to cesarean section. In even when the cesarean section is performed, the late when the patient is in full dilatation, there's so many factors, so many complications. So then we need to explain them. We need to, but after doing all this, after toiling with the patients for some hours together, being with the patient the whole night, after seeing the baby, we feel so relaxed and we feel so happy seeing the baby with us, and that's a life, new life. We feel as though we have done something great every time, because it happens with a complicated case, and more so the family, the whole of the family, and the smile on a mother's face. It gives a lot of satisfaction. That's the best part. The worst part is the work life balance and too many challenges. And even in rural India, I mean, with minimal facilities, we are provided with whatever facilities we have to adjust with them. And there are so many cultural and social taboos there. We have to, that is a challenge. And here in India, we manage being a lady, going out in odd times, the whole night, being with the patient, but still come home. We do the cooking, we manage the kids, their schooling or their education part, their health, the family's health, the parents' health. So it all, the work-life balance. And we cannot say that my mother is not well, so I cannot attend your uh, labor when you are in labor. I can't say that. So that is a challenge. And practicing in rural India, again, it's a challenge with minimal facilities, with their social taboos and cultural taboos, because they are very ignorant. So knowing that language and communicating with them and taking them into confidence and being with them. So it's again a challenge and it's a task. It's dealing with ignorant people. So it's like that.
Okay.
Ultimately, but the profession gives us a lot of satisfaction, because the new life every time, the new babies, uh, we hand over the baby to the mother. So there will be a lot of satisfaction in that profession, and it's my passion too.
Great. Okay, so now we'll move on to our myth section. Um, let's see if all of them are myths or not. Firstly, you must be 21 years old to begin seeing an OB/GYN.
No, not at all. Even the small babies, they come to us with the white discharge. The newborn babies, they may have white discharge. White discharge happens even in the school going small, tiny toddlers to school going third class girl or fourth, fifth class, fifth standard girls also. So they come with vaginal irritation, itching, or dryness, or discharges, or any outgrowths with folliculitis, as I told you, then or any infections, fungal or bacterial infections there. So anytime you can approach. It's not necessary. Age is not the criteria to approach. So any problem externally, internally, you can approach a gynecologist at any age.
Okay. It is necessary to go to the gynecologist every year.
Yeah, it is. Um, yes. After 30s, it is, because nowadays the earliest detection of cancer is being done with the screening procedures with pap smear and the screening procedures and also the breast examination. So earliest we are picking up the smallest tumors or in situ carcinomas we are able to pick up. So it's always better to come to a gynecologist every year after 30. And before 30s, whenever you have any problem, you can definitely approach the doctor.
Okay. Breast cancer doesn't run in my family, so I'm safe.
No, not at all. Even if it's not in your family, you may get breast cancer depending on your lifestyle, your habits, or your sometimes mm, even without the family history also, you may have cancerous changes in your any part of the body.
Okay. Cranberry juice cures UTIs or urinary tract infections.
Actually, it doesn't actually cure, but it is a supportive treatment. The cranberry juice actually relieves the burning sensation in the urine, and urine in a urinary tract infection, the most important symptom is a burning sensation while passing urine. So that sensation will be relieved with the cranberry juice. So it's a supportive treatment, but the main treatment is you need to have a CUE report and you need to get the culture sensitivity done to know the organism what is growing in your urine and the organism to which antibiotic or to which medication it is sensitive. The sensitive medications you prescribe, sensitive antibiotics you prescribe, and you treat the patient. That's how it is, not just a cranberry juice. Cranberry juice has to be added with the main prescription. It can be added. Even otherwise, cranberry juice, you can have plenty of oral fluids. Not everyone will have access to cranberry juice in the countryside. People living there in tribes, they don't get access to cranberry juice, isn't it? So the plain water also will suffice.
Okay. If I don't have any symptoms, I must not have a sexually transmitted infection.
Not necessarily. Some of the sexually transmitted infections are very silent. Although you have little outgrowths here and there, sometimes also with the ulcers on the tongue, which are painless, there are also syphilis. The Trypanosoma pallidum, it's a bacterial. Trypanosoma pallidum is a bacterial infection. So it can happen even without symptoms also.
Okay. And with that, we have concluded our myths section. And that has concluded our podcast with Dr. Rajashree. Thank you so much for being on my podcast. We have talked a lot about women's health and ways that female teenagers, especially, can improve their daily life and take good care of their reproductive systems. Thank you. And for our viewers, we have a slogan from our doctor.
Nourish your habits to flourish your lifestyle.
Okay. Thank you, doctor.